Again, I'm Russ Curtis, licensed clinical mental health counselor. This is a presentation I've given many times in the assessment class, so I hope you find this helpful. I'm going to go through it fairly quickly. Please comment if you have any questions. We're going to talk about the PHQ-9, the GAD-7, and the session rating scales. For the first one, particularly like in an integrated care setting, it may be that when you're filling out the initial paperwork, they may have the patient health questionnaire 2, which is just 2 initial questions. You see them here. Have you been bothered by feeling down, depressed, or hopeless? And then 2, have you been bothered by little interest or pleasure in doing things? And a positive response to either question identifies more than 90% of patients with major depression. It doesn't mean they necessarily have it, but we can use these just 2 screeners as they're filling out their demographic information to see if we need to move further and conduct the full PHQ-9. Here's an example of this is the PHQ-9, and it's 9 questions. That's where we got the 9. Again, this is public domain, so it's free to use if you're trained in assessment. And it goes from not at all to nearly every day. And we've talked about a couple questions, but little interest and pleasure in doing things, that would be a 0 for not at all. Nearly every day would be 3. And number 9 here is an important one. Thoughts, well, they're all important, but thoughts that you would be better off dead or hurting yourself. Not at all, 0. Nearly every day, 3. And clearly that would require more intensive suicidal assessment. And there's a lot of online versions of this that can be used. There's also algorithms. So the PHQ-9, 0 to 4 might be a minimal score, maybe outpatient counseling, to where if we had moderately severe, a score of 15 to 19. We would really want to make sure that we're doing a good, thorough assessment. And, particularly this may be that inpatient is needed. Again, this will always be under supervision, and you will collaborate with colleagues to make sure that you're making the best decisions here. But we want to make sure the client is getting the best care they need. And if they indicated 15 to 19 total points on the PHQ-9, that would mean that they're experiencing a lot of depression. I do like to kind of point out just that you'll hear clients talk about depression as a dark cloud that they can never get out from under, and often reported as a lack of emotion and hope. It's not just sadness. We can feel grief and sadness for many different things. Those are natural emotions, but a lot of times with depression, it's a lack of emotion and no hope. Could potentially be like dark night of the soul if we're going through really big transitions in careers or relationships. Not uncommon for us to experience that at certain points of our life. Now the GAD-7 is measuring anxiety, and again, as in integrated care, is an initial screener on just your basic demographic form that you fill out at your annual checkup. Here's a couple questions that would be on there. Have you been bothered by feeling nervous, anxious, or on edge? And number 2, have you been bothered by not being able to stop or control worrying? And we'll see what the scale is here. And of course, if there's any of those, if there's any positive response for these 2 questions, we'd want to do the full GAD-7, which is here. And a couple other questions here. Of course, it's 7 questions, the generalized anxiety disorder, 7 questions. I should mention it's over the last 2 weeks, have you been bothered by this? So it's not just like, oh, I've had that in my life, but I'm not feeling it now. Worrying too much about different things, and that could be on the scale of not at all, 0 to nearly every day. And let's see, becoming easily annoyed or irritable, not at all, nearly every day. And then we're just kind of going to add up these scores. I do like to mention that anxiety, if we look at existential therapy, that can be a signal of imbalance. Not necessarily a bad thing. Of course, it's uncomfortable and we don't want to feel it. But it can be an indication of like, wow, am I in the right career, the right school program, the right relationship? So we can kind of reframe anxiety as, oh, this could be the body's signal that we need to kind of take a closer look at what's going on in our life. Of course, there's always, hypersensitivity to, and I'm starting to wonder if that's the right term, but just, there are folks who are extremely sensitive to light, sounds, textures. I've posted videos about this. So we want to acknowledge that, because this may not be anxiety as much as just sensory experiences. Also, we need to keep open, and there are plenty of traditions that would suggest that that you can be in the presence of somebody and be experiencing kind of their disruption, and that affects you. Proprioceptive, we can be hyper aware of what we're experiencing inside, our breath rate, heartbeat. But I think in Western culture, a lot of times anxiety is just kind of associated with worry and rumination, and clearly that can be a part of it, but there can be other causes. So we want to look at all that. We want to keep a broad lens. Online versions of that. So the PHQ-9, this again would be great in medical settings because it's captures stuff very quickly, and it can be done just with generalized paperwork. The questions that we just asked, feeling nervous, anxious, not being able to stop worry, those would be the GAD-2. Little interest and pleasure in doing things, feeling down or depressed, hopeless, that would be PHQ-2. And so this might be a nice one just to kind of capture, to make sure that we're not missing somebody who's experiencing anxiety and depression, because this would exacerbate other types of health issues, engagement in the medical treatment, so forth. Now we're moving to the session outcome rating scales. Again, these are in the public domain. This is about measuring quality assurance. How is it going? Now the session with clients, the session rating scale is looking at counselor-client relationship, and the outcome rating scale is more aligned with some of the longer versions of just mental well-being in general. Remember that therapeutic alliance, the quality of counselor-client relationship, is the #1 predictor of client outcomes. We always want to pay attention to this, and that's why using a session rating scale periodically with your clients is helpful to make sure that we're maintaining quality assurance and providing the best services possible. I think it's also important to keep in mind, and it's one of the reasons of using this, is that we often think that stigma and access is the reason people don't seek treatment, but there's decent evidence to suggest that there's people that just don't believe in counseling, that it'll be helpful. And I know that can be kind of uncomfortable for folks, but I'll show you some research here in a second. About 47% did not see it as helpful, and this is the latest study I can find. I believe it was 2024. About 47% just said it's ineffective. And so the reason I've mentioned this is that I do think by demonstrating to clients that we really are concerned with how they see this process working, we may see this number increase. The session rating scale, it's brief and simple. It can reduce early termination. We're just looking at some general research. Improves outcomes, reduces formal complaints against mental health professionals. That's big. And it does have sound psychometric properties. So they have done convergent analysis with this with longer types of scales that are measuring counselor-client relationship. And it can certainly be used to validate the relationship or keep an eye on it. So it's actually fairly simple, and it is on a visual analog scale, which are these dashes here that are 10 centimeters if you get the paper version. So it can be measured. You can actually get a score. But the reason they do this is numbers can oftentimes get in the way of clients. Am I a 0 or a 10? And this is just, you're going to put an X on this analog where you are. If you need it for research, you can measure it with a 10 centimeter scale and get a number. So what we're looking at with the adult session rating scale, I did not feel heard, understood, and respected. And then the other side of that would be I felt heard, understood, and respected. We're looking at goals and topics. We did not work on or talk about what I wanted to work on and talk about. We did work on what I wanted to talk about. The approach and method, the therapist approach is good for me versus the therapist approach is a good fit for me. And I'm sorry. The first one would have been the therapist approach is not a good fit, and then the better one is it is a good fit. And overall, there was something missing in this session versus overall today's session was right for me. Okay, and there's one for children. We got some emojis here, and even young children can kind of fill out their own. I've seen some cute examples of this. This is what I was talking about, how we can measure it, and you can see it there. It's 10 centimeter lines. Boom. What they're finding session rating scale is that typically clients rate it pretty high. So if you're getting a score of lower than 34, we would want to check in with whatever the client's goals is. Just how's this working with them? Are there things I need to be doing more or less of? And pay close attention to that. So that's why the highest score you can get is a 40. And just from research, they're showing that if you score less than 34, that there might be an issue with the counselor-client relationship, and that needs to be addressed if there's going to be any progress made whatsoever. Good example of it, I've got it on YouTube, a couple of them. Now, the outcome rating scale is a global measure of distress, and there is convergent validity showing that this matches with some of the longer forms. We've talked about that. Significantly correlated with self-esteem, self-efficacy, and quality of life. And the adult outcome rating scale looks like this. Again, on a visual analog, you're seeing where the low and the high would be. The client would put an X on this, and of course, it's all kind of online versions for this. For confidentiality's sake, maybe you want to keep them on paper, but individually, personal well-being, how are you doing? Interpersonally, family or close relationships, how are you doing? Socially, work, school, friendships, and then overall general sense of well-being. So this is covering a lot of the big domains that people come to mental health for or are experiencing when they are in medical settings and they've got an illness, and all of these domains are being affected. Now there's one for children with the emojis, and then there's one where children can be creative with this. And the outcome rating scale is if they score high on this initially. What this means, if they score high on the outcome rating scale initially, it means they're doing really well. So why are they in counseling? We would want to just be really clear about why they're there and what their goals are, because it could be that they're there because other people are making them and they don't want to be there. And we need to be able to address that and talk honestly about that. So that's what this chart means, is at a higher initial, we want the score to go up if it's low, but if they initially score high, we need to make sure that we're exploring that thoroughly to make sure why they're there. And this is just one example of what it can look like if clients are filling this out digitally. I know there's different practices that require this. Okay, good people, I hope that was helpful, and there's plenty of videos